Something is damaging your tooth right now, and you probably do not feel it, yet the pain always comes later, and when it does, it means the problem is already deeper than you think. That sudden sharp pain when you drink something cold, or that deep throbbing ache that keeps you awake at night, is not random. It is a signal, and by the time you feel it, the damage has already reached the most sensitive part of your tooth. To understand why your teeth hurt, you need to see what is happening inside. Your tooth is not solid, it is layered like a structure built to protect something extremely sensitive. The outer layer is enamel. It is the hardest material in your body, and its job is to block everything heat, cold, pressure, and bacteria under. That is dentin, a softer layer filled with microscopic channels, and at the center is the pulp where your nerves and blood vessels live. This is where pain begins. At first, nothing hurts. That is the dangerous part. Every time you eat sugar, bacteria in your mouth produce acid. This acid slowly dissolves the enamel layer. It does not happen instantly. It happens silently over days, weeks, and months. The surface weakens, and tiny invisible openings begin to form. You will not feel this stage. But once the damage reaches dentin, everything changes. Dentin is not a barrier, it is a network. Thousands of microscopic tubules act like direct pathways to the nerve. Suddenly, cold drinks, sweet foods, and even air can travel straight inside your tooth. That quick, sharp pain you feel is not the surface, it is your nerve reacting in real time. And it only gets worse. If the decay continues, it eventually breaks into the pulp. This is where the pain becomes intense and constant, because now bacteria are inside the nerve itself, multiplying and creating pressure inside a space that cannot expand. This is why tooth pain starts to throb. It is not just irritation anymore, it is inflammation trapped inside your tooth with nowhere to go. You may feel pain without eating, without drinking, even without touching the tooth. It can wake you up at night, it can spread to your jaw, your ear, or your head. At this stage, the tooth cannot heal on its own. But cavities are not the only reason your teeth hurt. Sometimes the pain comes from exposure, not damage. If your enamel wears down or your gums begin to recede, the dentin becomes exposed again. Those microscopic channels are now open. Cold air, hot drinks, sugar, everything hits the nerve instantly. The pain is sharp, fast, and easy to trigger. This is what people call sensitivity, but in reality, it is your protection layer failing. And many people cause this themselves without realizing it. Brushing too hard does not clean better, it destroys your protection. Over time, aggressive brushing wears down enamel and pushes gums away from the tooth, exposing the root. The root has no enamel, which makes it far more sensitive. What feels like good hygiene can slowly turn into constant discomfort. Another hidden cause is grinding. Many people grind their teeth at night without knowing it. The pressure is constant and strong enough to wear down enamel. Over time, as the protective layer becomes thinner, the dentin is exposed and sensitivity increases. In more severe cases, this pressure can create tiny cracks in the tooth. Cracks are dangerous because they are almost invisible. When you bite down, the crack opens slightly, allowing pressure to reach deep inside the tooth. That sudden sharp pain when chewing is often a sign of structural damage. Even a small fracture can lead to serious problems if ignored. And then there is gum disease. This does not start with pain, it starts with plaque, a thin layer of bacteria that builds up along the gum line. If it is not removed, it hardens into tartar, which irritates the gums. They become inflamed, swollen, and begin to pull away from the teeth. As the gums recede, they expose the root surface again. This area is not protected, which leads to sensitivity, but it does not stop there. In advanced stages, the infection spreads deeper, affecting the bone that supports your teeth. This can lead to movement instability and chronic pain. The important thing to understand is this: pain is not the beginning of the problem, it is the final warning. By the time your tooth hurts, the damage has already progressed beyond the early stage. That is why some pain feels different. A short, sharp reaction to cold usually means exposed dentin. A lingering pain, especially with heat, often signals deeper involvement closer to the nerve. Pain when biting can indicate a crack or internal pressure. Constant throbbing pain is often a sign of infection inside the pulp. Each type of pain tells a different story. Ignoring these signals allows the problem to grow. Treatment depends on how far it has progressed. If caught early, a simple filling can stop decay and restore the tooth. But once the pulp is involved, the treatment becomes more complex. A root canal is needed to remove the infected tissue and seal the tooth. In cases where the structure is too damaged, the tooth may need to be removed completely. This is why early action matters. The difference between a small filling and a major procedure is often just time. The good news is that most of these problems are preventable. Daily habits determine long-term outcomes. Brushing gently with a soft toothbrush protects enamel instead of wearing it down. Fluoride strengthens the surface and helps resist acid attacks. Flossing removes plaque from areas your toothbrush cannot reach. Reducing sugar intake limits the fuel bacteria need to produce acid. And regular dental visits allow problems to be detected before they turn into pain. Because once pain starts, the situation has already changed. Tooth pain may feel sudden, but it is almost always the result of a process that has been developing silently. Understanding that process changes everything. When you know what is happening inside your tooth, you stop reacting to pain and start preventing it. Your teeth are strong, but they depend on protection, and once that protection is compromised, the consequences build step by step until your body forces you to notice. Pain is not the problem. It is the signal. And the sooner you understand it, the better chance you have to stop it before it becomes something much worse.